Data gaps are limiting investment in women's health as climate risks rise. Investment in women's health continues to lag its economic and societal relevance, even as climate stress, workforce exposure, and disclosure expectations increase. On January 20th, the World Economic Forum F published the Women's Health Investment Outlook 2026, documenting a persistent gap between the scale of women's health needs and the capital, data, and infrastructure allocated to address them. The report positions this gap not simply as a missed market opportunity, but as a systemic vulnerability that becomes more consequential as external pressures intensify. Women account for more than half of the global population and a majority of healthcare decision-making, yet conditions that disproportionately or uniquely affect women remain under-researched and underfunded. The outlook points to fragmented data, inconsistent definitions of women's health, and limited integration across healthcare, workforce, and policy systems as key barriers to investment. These dynamics mirror patterns emerging across other sectors this week. When data is incomplete, investment hesitates, and temporary workarounds fill the gap. Climate disparities are increasing health exposure. The report intersects with a growing body of evidence showing that climate-related stressors disproportionately affect women's health outcomes. Heat exposure, air pollution, food insecurity, and water scarcity carry differentiated risks for pregnant women, caregivers, and those in frontline or informal work. As climate volatility increases, these impacts move beyond public health into workforce resilience, healthcare demand, and community stability. Yet women's health risks remain underrepresented in climate adaptation planning, physical risk assessments, and resilience strategies. The result is a familiar exposure pathway. Risk accumulates quietly until stress makes it visible. Compliance expectations are rising faster than measurement. While women's health has traditionally been framed as a social or equity issue, regulatory and disclosure frameworks are beginning to pull it into governance conversations. Health equity metrics, workforce well-being disclosures, and climate-related reporting increasingly expect organizations to demonstrate how differentiated risks are identified and managed. The WF report highlights a recurring tension. Expectations are rising faster than standardized measurement frameworks. Organizations are asked to acknowledge risk before robust comparable data systems exist to track it consistently. Data gaps are becoming governance gaps. A central finding of the outlook is the absence of standardized, sex-disaggregated health data across regions and income levels. Without it, policymakers struggle to target interventions, investors struggle to price risk, and organizations struggle to demonstrate due diligence. This is not simply a research challenge. It is a governance issue, one that becomes harder to defend as climate impacts intensify and disclosure expectations expand. Why this matters now. The women's health investment gap follows a trajectory familiar across energy, infrastructure, and compliance systems. Long-standing underinvestment, fragmented data, and rising scrutiny once stress becomes unavoidable. The outlook does not argue that this gap will close quickly. It documents the conditions under which it persists and the exposure that builds when systems fail to keep pace with reality. You've been listening to Sustainability Soundbites by Environment and Energy Leader. For partnership opportunities, please reach out to our team.